Well, there you go. Hello, everyone, and welcome to another informative week of Qyral skincare training and Q&A. I'm Honey Sagari, founder and CEO of Qyral, and today we have a very special guest joining us. Please give a warm welcome to the esteemed and gorgeous Dr. Stephanie Martin, who, by the way, is a mom dermatologist and founder of Cal Coast Dermatology. I apologize. Before we get started, let me brag a little about Dr. Stephanie. She's an expert in the field of dermatology with a focus on micrographic surgery and dermatological oncology. She earned her medical degree from the University of Texas Health Science Center, let's go Longhorns, and completed her dermatology residency at UCLA, where she was chief resident in her final year. And that's not too far from the Qyral HQ, we'll say. With double board certifications and fellowship under her belt, she's an esteemed member of various prestigious dermatological organizations. As chief of dermatological surgery for the VA Greater Los Angeles healthcare system and a core faculty member at the UCLA Micrographic Surgery and Dermatological Oncology Fellowship Training Program. Wow. Dr. Stephanie's expertise is unparalleled. When she's not busy helping patients and training future dermatologists and physicians, Dr. Stephanie loves spending time with her family, enjoying outdoor activities like hiking, swimming, sailing, and skiing, all with careful application of sunscreen, of course. Today, we're so lucky to have her here to answer some exciting skincare questions. So let's dive in and learn from the best. Dr. Stephanie, thank you so much for joining us today and being here. You're truly amazing. Balancing a successful career, being a mom, I'm so impressed. I'm just in awe of your multitasking abilities. Could you share with us what drove you to become a dermatologist, where the passion started? Just tell us a little about yourself.
Yeah, well, thank you. I think my drive was to get that kind of introduction. My goodness. So it's so great to be here. Thank you. The skin is an incredible organ. It's the largest organ in the body. And when I was in medical school and rotating through different specialties, it's hard to convince patients that they need to take care of something that they can't see, that they can't touch, and that they aren't necessarily seeing the day-to-day results, like something like blood pressure or diabetes. As opposed to the skin, where when you're caring for someone's skin and clearing up any lesion that they have on their skin, it's really rewarding because they can see it and they're motivated to get that clearance. And so that was really my driving force. And then again, being able to care for birth till a death, and having babies and elderly patients can span the spectrum in dermatology.
Yeah, well, thank you. Thank you for doing that. And what drove you to specifically study skin cancer and become a oncologist at that?
Yeah, so I always liked surgery, and I rotated as a medical student with a skin cancer surgeon who removed some really large tumors and reconstructed the area to make it look like hardly anything was ever done. And I remember working with this physician, and she had a few kids, and her work-life balance seemed something that I wanted to attain. And so getting that combination of having a surgical subspecialty while still being able to be a mom and have a life outside of work seemed like a great fit. And being able to do reconstructions is the most rewarding part of my job.
So with that said, I mean, what is one piece of advice you would give patients or individuals? What should they look out for on their skin? What kind of lesions, or what advice do you give patients?
Great question. So, unfortunately, as we get older, different growths come up. But if there's something that is new, changing, something that was not there prior and seems to just not be going away, and if you can feel some irritation associated with it, if you can feel some roughness that otherwise it's not like the surrounding skin, that's something that should be looked at. Doesn't mean every rough growth is something concerning, but we, especially with having a history of significant sun exposure, having a family history of skin cancer, those are all things that can contribute to the development of skin cancer. And so, the being proactive and finding something early is the best way to attack it, and as opposed to letting something go and just ignoring it. So just like anything in healthcare, anything in medicine, prevention is key, and that's something that is really exciting about Qyral, and what your company is promoting is that prevention, and to really be on top of what changes can be happening in the skin, because as we get older and as time goes on, there are changes that happen, and we can help minimize some of the negative changes and help enhance some of the more positive changes.
I love that. So when it comes to anti-aging, what are your top recommendations?
So the best thing that you can do for your skin is sun protection. In a perfect world, we all stay inside and don't let the sun ever touch our skin. That comes with a host of other issues. We need vitamin D. And as you mentioned, my favorite things to do are outside. I love being outdoors. So just being careful with that sun protection, with physical blocking sunscreens, with physical barrier protection of hats and clothing. And then after that is being careful with hydration, drinking plenty of water really helps with that anti-aging. And then there's some topical products to put on as well. There's a host of anti-aging products on the market, some that are more effective than others. I think we're gonna talk about a couple of those.
Yeah. So for individuals who want to prevent aging without splurging on expensive treatments, what cost-effective options can they start today?
Great question. And you're absolutely right. You can spend a lot of money on skincare, and it can be a pretty overwhelming, daunting thing when you're hearing about all these different expensive treatments that are just not practical for the average person. So, there's some really key topicals that can be utilized in addition to good sun protection, sunscreen. I tell all my patients be on a topical retinoid. Tretinoin is a great one, depending on your skin type and what prescription strength versus and what concentration is needed. But a topical tretinoin is really key to it. And then, depending on the history of skin cancer, there's been great studies that have shown that there's evidence that niacinamide can decrease the incidence of skin cancer, especially in patients who have had several non-melanoma skin cancers, which include basal cells and squamous cell carcinomas. Niacinamide can decrease that incidence. There's also some evidence to show that vitamin C and its antioxidant properties can help limit the sun or the anti-aging process and decrease that. And I have a lot of patients saying, okay, well, how much do I take? I'm worried that I could be utilizing too much of this. And the good thing about both niacinamide and vitamin C is they're water soluble vitamins. So it's not something that we need to worry about overdosing or anything like that. And then I also tell patients that if you already have some photoaging, then there's also different to lighten the pigmentation. There's also different topicals that can be utilized, not just lasers that can be very expensive, but topical hydroquinone is a commonly prescribed medication that causes just lightening of those dark spots that can happen as our skin ages.
That's wonderful. And if you do want to splurge, is there a specific laser treatment that you do recommend for your patients?
Great question. Yeah, great question. So if you have want to spend a little bit more depending on what you're targeting. So every laser is just an acronym for having light amplification, and so it's really focusing a wavelength to hit a chromophore or a molecule that is trying to target to essentially destroy. So there's the chromophore melanin, which is the pigment in the skin, is targeted by a few different devices. One that I really like, that I utilize a lot in my practice, is IPL, which is intense pulse light. It's a broad-based wavelength of light that targets that pigment, causes those lesions to, and you can see it, crust up and peel off and have that sloughing of that pigment that can happen over time. If depending on, with aging, you can also get broken blood vessels and dilated blood vessels. So that redness in the skin that can be pretty apparent. There's a great laser, pulse dye laser, also known as V-beam, that I utilize frequently for patients who have those broken blood vessels and capillaries. And those are really just are most effectively treated users. And then, there's others that can help promote collagen formation and various aspects of skin tightening, but it all depends on what the patient is looking for their anti-aging treatment and their budget.
And what if someone has really bad scarring on their face or other parts of their body and they want to get rid of those scars, like ice pick scars? What do they do? What laser treatment would you recommend? Would tretinoin even work for something like that?
Great question. So, tretinoin definitely has its place in scar treatment. How tretinoin works, it targets the nucleus of the cell to increase mitotic activity, to have kind of the skin sloughing. That's why you get that initial peeling when you use topical tretinoin cream. However, it's really targeting that pigment. As far as the collagen formation, if you look at the studies, we'll say, there's some promotion of collagen formation using tretinoin, but that is relatively limited. Again, you're using, with the cream, there are some devices that can penetrate down into the skin. The one that I use most commonly is radiofrequency microneedling, which basically puts needles directly down into the dermis, and then radiofrequency energy is released. And by doing that, it causes basically this tissue contraction and the skin tightening and the remodeling that area to help even out scars. So that's my most commonly used device when patients come in with either acne scarring or traumatic scarring. But there is a place for using tretinoin in conjunction, and we'll have some benefit. It'll just be, it could be a little bit more limited.
And so, you touched on this briefly. Can you explain to us how tretinoin exactly works? What role does it play in the cellular turnover cycle of the skin?
Yeah. Good question. So how tretinoin works, so it's a vitamin A derivative. People are pretty familiar with Accutane. Accutane is a vitamin A derivative as well that is taken orally. Tretinoin is a topical retin-A that is still in that vitamin A category. And what it does, it targets the retinoic acid receptors as well as the retinoid X receptors in the nucleus of the cell. So that's just fancy lingo for basically saying there's a receptor inside the nucleus of the cell that then when that tretinoin binds to that receptor, then it results in increased mitotic activity. It kind of stimulates that cell turnover and by increasing that turnover, it causes those cells that are already loosely adherent to essentially slough off. So when one of the first things I tell patients when they're shown on a topical tretinoin is saying, no, you're going to get some peeling. You're going to get some, the medical term is desquamation, or that kind of roughness of the skin. And that's good. You want that. And that's just getting rid of what is there of those looser cells, just kind of sloughing those off. But one thing that, then the next question is, okay, well, it's no longer sloughing. Is it still working? And yes, it is still working. You're still having the effect of the tretinoin. What's happening now is those cells that are already loosely adhered, those have been removed, but now you're just keeping in that constant state of creating that cell turnover in that top layer of the epidermis, or top layer of the skin. Now you can go up on the strength. So, tretinoin comes in various different formulations and strengths. And so one important thing that I always ask patients is, what is your skin type? We're all created equal as far as the core of us, but how we're all, our skin type, our skin appearance, it's all different, and that makes us special and unique. And that's one of the things that I love about my job, is that you can embrace those differences. And by doing that, all tretinoin it's not all the same for every patient of what they need and that strength. And so when someone does start having, they might not be seeing any effects of that peeling, or it's okay, and continue that strength, but sometimes can also increase and see if, okay, let's do a little bit more and see if you can tolerate a higher prescription strength. Now the tolerance is important, because what also can come is inflammation. And so if there's a lot of redness, a lot of irritation that is more so than just getting that peeling, then it might be, an indicator to scale back just a bit.
Can you talk to us about the purging period? A lot of people notice right away, oh my God, my skin, it looks terrible. Like, what is this? You said you're going to help us. And look, my skin looks terrible. Can you talk to us about those first initial couple weeks for people who have never used tretinoin before? What do those first initial weeks look like? And then also maybe you can talk about how long someone should stay on tretinoin. Is this something you could get on when you're 13 and get off never? Or is there a specific period? Should you rotate it? Maybe you could talk to us a little about that.
Yeah, great question. So as far as for the that initial quote unquote purging period, that's all normal. That's all to be expected. That's again, it's what's really being targeted initially are those really loosely adherent cells and that turnover process that is going to happen. Everyone's tolerance is different as far as what they're okay with for that initial purging. So just talking with patients and seeing, are you okay with having some peeling, having some, some of that sloughing? And if they're not, then you don't necessarily need to decrease the percentage of tretinoin, but can decrease the frequency of application. So that I will tell patients, initially, if you don't want a lot of that, just start once a week. Just put on the cream once in the evening, wash it off in the morning. By doing it once a week, you won't have as intense of that purging. But after about 3 to 4 weeks, typically, that's over, and then you're and all those loosely adhered cells that needed to come off are gone, and then should be at more of a maintenance regimen.
Oh, I love that. Okay. So how about mixing it with their moisturizer? When should they do that? If someone has severe sensitivity, should they do something like that, or should they apply it on top?
Great question. So definitely moisturizing the skin is vital to caring for the skin, both hydrating internally by drinking lots of water and hydrating exteriorly by adding moisturizer is really important. So I don't like to do one versus the other. I like to do in conjunction because again, keeping that moisture locked in the skin will just help promote its overall appearance. So I'll tell patients just put the tretinoin, a pea-sized amount. You don't need a ton. Put a pea-sized amount, dot forehead, nose, cheeks, and chin, and kind of spread that evenly around with that one pea-sized amount. Let it sit for a few minutes. Let it dry. Let it really, so you're not just wiping it right off as you're adding something else. But once that as you're adding something else, but once that is dry, then can add a grease some of that peeling, or at least the appearance of it. But I definitely, tell patients that if you're going to be on a tretinoin, you should also be on a moisturizer. Don't do one without the other. And then as far as time course, so if we just could no longer age and then we're set in time and you're good, you're done. But that's not reality. And unfortunately, we are all still aging. And so that is a regimen that I am on every day. And I tell my patients to, if you can utilize that every day, that will only help in moving forward with the aging of the skin. So there's no real endpoint. But on patients who are like, hey, I don't want to do this forever, that's okay too. Any application that you do will help. And so if you want to take breaks from it, that's absolutely okay. But you can, there's been some really good studies, and tretinoin has been on the market for a long time of showing that long-term application is safe and it is effective.
Yeah. And how about under eye wrinkles? Like, I get this question all the time. What should you do? What can you do with under eye wrinkles?
Good question. So yeah, the under eyes, that it's tough because it's very thin skin. It is easily irritated skin because of its unique properties of not having a thick dermis. The dermis is kind of the second part of the skin. So the top layer is that epidermis, the middle is the dermis, and then lower is kind of the fat and the subcutaneous tissue. The dermis of the eyelid is relatively non-existent, and it's very, very thin. So because of that, irritation can happen readily. So I'll tell patients, tretinoin can absolutely help with that, but that is an area where it needs to be applied a little less liberally and a little less frequently, just to avoid more of the irritation. And then keeping good hydration on that area, moisturizing well. There's various eye creams on the market that can be really helpful with that. And then if you have a little more, let's be honest, we're like, bring out the elephant in the room. Botox is a wonderful thing too for it.
Okay, and how about fillers for under the eye, or what can you do? Like if you
Yeah.
have really bad wrinkles, what laser treatment would you recommend? Would you recommend fillers? Yeah.
Yeah.
Give us all
Great.
the scoop, please.
Okay, great question. So yeah, so under the under eye area, it's really important to evaluate that carefully of seeing what is going on. Why is there the under eye either darkening? Why is there also the under eye contour difference? So what happens as we age is things fall, unfortunately, and we get fat pad redistribution. There's 3 fat pads on the lower lid. And as those redistribute over time, it can cause kind of a hollowing out or even a depression that happens from the lower eyelid to the cheek that's called the tear trough. A filler can help in that area of kind of bringing up that hollowed out tear trough. So that can be utilized. The one thing about filler, it's not forever. So it lasts about 9 months to a year. But it's relatively simple to do. But it's, and that can help pull or bring out that lost volume. Another option is laser. So there's 2 lasers that can do really well for the skin texture as well as the tightening, and that's the radio frequency microneedling devices that I was referring to earlier, as well as a CO2. A CO2 is a little more aggressive. It has a little more downtime, but it can have some good tightening as well. So those are really the 2 mainstay devices for that area. And if it's more pigmentation, then it's wondering, okay, what is causing that pigmentation in the lower eyelid? Is it more just from blood vessels that are causing kind of darkening and kind of purplish color? Then targeting those blood vessels with a laser that again target, which is that pulse dye laser, can do well with minimizing that cause of pigmentation. If the pigmentation is from shadowing, again from the fat pad redistribution, that's where filler and will come into play there. And if it's from just hyperpigmentation, then that's where bleaching creams can sometimes be utilized that can help lighten that darker pigment. And then the most aggressive treatment is surgery. So lower lid blepharoplasty. A blepharoplasty is a fancy term for eyelid surgery that can, if done well, it doesn't only tighten the skin, but also then taking the fat pads that have redistributed and laying them softly across the cheek to where it smooths out that contour difference can be a beautiful result.
Thank you for that. And as far as going and getting, we were talking about fillers and Botox. Can you use that with your skincare treatments? I get this question a lot. Can I use tretinoin with Botox? Will it diminish the results? Will it, make it dissolve faster? What's the scoop on that?
Great question. And yes, absolutely. All of these things can be done in conjunction. I just tell patients on the day of an injection, not to use any other topical products just that night, just so that they don't have any increased irritation or just from the area of the injection. But starting the very next day, I encourage patients get back to their skincare regimen, make sure that you're not dropping off on that, and to be consistent with it. So, there's some lasers that require a little more downtime depending on what the device is, and that would be discussed. But there's sometimes there's a couple devices that I use that I'll have patients take about a week or 2 off from any other topical treatments. But again, those are some of the more aggressive lasers, but simple injections like Botox and filler with your skincare regimen.
I love it. I've been using a Botox for preventative reasons. I was the cat's out of the hat, but I started using it when I was younger, and that was like one of the best recommendations I received. Just use it for preventative measures, and my skin has somehow maintained itself throughout the years. I've used it in conjunction with tretinoin, but so
your skin looks beautiful. So yes, keep that up. I had a patient come in. This was a few months ago, and she's like, I'm really considering doing Botox, and I look at my friends, and they don't have these lines, but they don't use Botox. And I looked at her like, well, your friends are half my patients, and they're lying to you. There you go.
feel like there's a stigma associated with Botox, like you're gonna look frozen. And no, if you go somewhere where the technician or the doctor knows what they're doing, I mean, it could look very, very natural. You could still have all the, expressions, facial expressions, right?
Absolutely, absolutely. And with anything, with any injection or device, going to an experienced a practitioner who knows where to place those injections. My goal for anything cosmetic is for someone to take a look and say, hey, you look great. You look refreshed. You look rested. I can't quite pinpoint what it is, but you just look good. I don't want someone saying, oh, wow, you got an injection. You're looking like you got some Botox or filler. That's not the result. And a good, an experienced injector can achieve those results.
Right. Perfect. So you touched on hyperpigmentation. What are the causes of hyperpigmentation? Melasma. Maybe you could talk a little about that. Like what causes it? And then we could talk about other body parts. So first, let's talk about melasma hyperpigmentation in our skin, and then what causes it under arms, between our thighs, and our other areas.
Yeah, great question. So, there's several causes of hyperpigmentation. On the face of women, the most common is melasma. Melasma is basically melanin deposition in the more superficial part of the skin that is most commonly attributed to hormones and to sun. The sun can exacerbate it as well. But when someone talks about the mask of pregnancy, that's melasma. That's what is happening there. And because in pregnancy, hormone levels are really elevated, and then getting that pigment deposition. Some oral contraceptives or birth control pills can cause that as well, because again, adding hormones to the body. And it's a tough, it can be a tough thing to fully treat, because like anything, unless the underlying cause is addressed, then it can be improved, but to totally have it resolved, it can be a challenge. So the nice thing with pregnancy is the underlying cause is eventually addressed, and with birth, but then all the hormonal changes that happen after. So that is really where, in combination, tretinoin with a topical bleaching cream. So hydroquinone is the most utilized one on the market. It comes in several different strengths. It can be compounded to be a little bit stronger. That is really helpful in those cases. Hydroquinone is a topical cream that basically how it works. It causes melanin pigment production. So melanin is that pigment in our skin. It causes that production of that pigment to be reduced. And it does that by blocking an enzyme in our skin. There's an enzyme called tyrosinase, and tyrosinase is directly attributed to resulting in melanin production. So if you think about, you block the enzyme that produces it, then you won't have that pigment production. So that's something also too that I counsel patients on, is that when you first use hydroquinone, you're not going to automatically have results. You don't put it on and then 2 days later, oh, I'm clear. Because what's happening is it's blocking that melanin production moving forward. So the melanin that's there, that needs to be sloughed off. It needs to be absorbed by the body. And so that's also why then hydroquinone in conjunction with tretinoin can be helpful, because tretinoin, it doesn't target the pigment itself. What it does is it helps that skin sloughing, that cell turnover. And by doing that, that's the pigment that's already there, while hydroquinone helps prevent further pigment from being deposited.
Oh, that makes total sense. So you mentioned that it's the underlying cause is typically hormones. So what does someone do? They go on hydroquinone, but I want to address the underlying cause. Do you recommend that they get a hormone panel done to figure out what's off? Like what do they do?
Yeah, great question. So melasma is such a common thing that it's not, hormone panels aren't typically recommended if someone has, just the run-of-the-mill melasma. What I first ask is, okay, what supplements are you taking? Are you on a birth control pill? Are you on are you trying to get pregnant? Have you recently had a pregnancy? Are you breastfeeding? Are any possible cause for those hormone imbalances or hormone increases, I should say? Some of those can be addressed if it is something like birth control, sometimes switching that around so that it's can find a little different estrogen progesterone combination. So that can sometimes be helpful. And then if there are some underlying causes as well that can cause pigmentation, so one of which is diabetes. So diabetes is known, so we were talking about in other areas of the body that can cause pigmentation in other areas. So, I'll just ask patients kind of screen for risk factors, then check a hemoglobin A1C, which is a blood marker that can indicate any possible diabetes. And then if there is any concern with having a underlying medical concerns, such as issue with the ovaries or an issue with the adrenal gland, these are all that cause hormone production, then I'll get a blood panel. But that's in very rare circumstances. And for set patients, the vast majority, it's just, it's how your body responds to those hormones, and also how your body responds to sun. So, and melasma is not just, I keep talking about women because we're, but it can happen with men too. So it's not just a female issue. And that's also something, it's exciting in this day and age. We're talking about these for skincare regimen and for all of that. It is for men too. And it's, I have men come in and like, I don't want anyone to know. And you're like, so it's okay. Let's treat this too, because it's not just issues that women deal with. And so having that, having that arsenal of topicals to be able to treat it can really do well.
Now, is hydroquinone safe for other body parts except the face? Where should you not use hydroquinone?
Yeah, good question. So, on mucosal surfaces, so it's not something that should be applied anywhere, like on the mouth or on the vagina or anything like that. I'll have patients ask me as far as pigmentation there, and I'm like, don't put hydroquinone in those areas. But hydroquinone, as far as on the skin surface, it is safe. It is. Now, one thing to remember, there is a paradoxical, which means an opposite reaction that can occur with hydroquinone after it's applied for long-term application. So, in the literature, it talks about how this paradoxical reaction can happen after 3 months. It's rare; it's usually longer than that. But I tell patients who are using hydroquinone to take a break from it. So after using it for 3 months, take at least a month or so off, and that is to help prevent that paradoxical reaction, which is called ochronosis, which is, again, a fancy medical term for saying that you get pigment production from a cream that you're using to decrease pigment. So it's really important to counsel patients that hydroquinone is not something that should be used long-term indefinitely with no breaks. That's in opposition to tretinoin, that has shown that you can use it long-term, not need to take a break, and it's safe for the skin.
Yeah, we switch patients to azelaic acid automatically after, 3 rotations. We switch them to azelaic acid for 3 rotations. Is that
yeah, that's a great plan. Yep. And azelaic acid can help as well. There's been evidence to show that can help pigmentation as well without the risk of that kind of opposite reaction happening. So by cycling patients off hydroquinone and switching to azelaic acid is really important, long term for these patients.
Yeah, I want to be mindful of our time, but we get so many questions about rosacea. I want to kind of quickly touch on that. Can you explain to us what causes rosacea? What can patients who suffer from rosacea, what can they do? Can you talk a little about that?
Yeah, absolutely. So, the first thing I always tell patients who have rosacea is it's a chronic thing. It's not something that has a cure, but it's something that has great treatment that can make it go away, but it will come back. So to set those expectations early, to tell patients where it's not curing, it's treating it. And as it comes, then we treat it. There's different forms of rosacea, depending on, so there's an ocular form that causes redness of the eyes. There's a form on the nose that kind of causes that larger kind of bulbous nose. And then there's just a form that kind of has a combination with acne that has like those pustules and those bumps. And then there's a just red form, a redness form. It's called erythrotelangiectatic, where you just have diffuse redness and some dilated blood vessels, mainly on the cheeks and nose. Depending on the type is what is the most effective treatment. For the eyes and the papulopustular form, an oral antibiotic is often needed just to get over that initial inflammatory period, and then topicals can be utilized as well. For the most common, which is just that redness in the dilated vessels, oral medication really isn't needed for that. There's a few different topicals that are readily utilized, one of which is just a topical antibiotic or something called Metro Cream, which is metronidazole in a cream formulation that can help minimize a little bit of the redness. There's another medication called Soolantra that can help. And then there are several devices that people utilize. So a beam vascular laser that's targeting those dilated blood vessels. And then one of the most important treatment is sun protection. So rosacea is known to flare with sun. So having really vigilant sun protection, especially as the skin is flaring, is really important. And then in conjunction, so the rosacea has a component to it of where there's known triggers. So finding out what those triggers are, alcohol is a common one. Spicy foods is another common one. And so, sometimes patients don't necessarily make that correlation, but trying to tease out, is there a known flare that causes that? And then long term, so one hard thing with, when you're treating for anti-aging, some of these like tretinoin and hydroquinone can sometimes come with a little bit of redness. And then when you have rosacea, you already have some redness. So to treat these both simultaneously is really important.
Well, thank you so much. I know you have patients in like 5 minutes, so you have to go, but any last words, any final tips, any advice that you could share with our viewers?
Yeah, no, I mean,
hydrate, sunscreen, we got those too. Use your tretinoin.
Hydrate and sunscreen. It's an exciting time to be in skincare. There's a lot of advances for taking care of the skin, and with sun protection, hydrate, and then the Qyral products that are targeting a lot of things that we talked about, and it's exciting, and it can really help patients in great ways.
Thank you so much for this. This was exceptional. Thank you. And I hope you come back and answer more questions. I mean, we have tons of questions. There's no shortage of it, but I hope you can come back. This is lovely. Thank you.
My pleasure. Take care.
I hope you guys enjoyed this segment with Dr. Stephanie. Stay tuned next week for more training. Thank you all so much. Thank you again, Dr. Stephanie. We love this. And see you soon. Bye, everyone. Bye-bye.